Well, a short time ago, I spoke to William Schomburg, head of the International Committee of the Red Cross delegation in Gaza, and he's currently dealing with people at the ICRC field hospital in Rafah. And because of the communication difficulties, we could only reach him on the phone. I should warn you, there is flash photography in the images we've used over it.
There aren't really words to describe how devastating the picture is tonight in Rafah. We today have had, again, a serious incident that has led to an influx of patients into the Red Cross field hospital here in Rafah. We're talking about burns, terrible shrapnel wounds, children, women, all of whom have been affected by the ongoing hostilities. At the same time, there's an overwhelming sense of fear and panic as the operations in Rafah intensify, and there have been yet further displacements. I can look out now, see hordes of people scraping together everything they have and trying to get out of here, whether it's on foot, donkey or car.
Are you going to be able to stay there?
We are committed to meeting the humanitarian needs of civilians in Gaza, which have reached unprecedented levels. We have a field hospital, like I mentioned. We have an office here, and we're doing everything that we can to support civilian needs, and we will stay here and continue with our work.
Can you give me any sense of the scale of the hospital and how many patients you're dealing with?
The other night, following the airstrike on the Kuwaiti Peace IDP camp, we received, I believe, 32 patients, heavily wounded individuals. We conducted amputations, dealt with several very difficult burns cases. We also have an outpatient department where we have a constant flow of civilians coming in, those who have been weapon wounded, but also just families who are looking for some healthcare in a situation where there are almost no functioning hospitals.
And what happens to patients who have such drastic surgery, such as amputations, after you've dealt with them? Where can they go?
We try and follow up with them, but of course, we have other patients that we need to tend to. For the time being, they will stay within the hospital, and then after that, we will see with the families what options that they have, and they will most likely return back to different camps or homes that they've been living in following the displacement of the majority of the population for several months now.
And how heavy is the Israeli bombing at the moment, the airstrikes? Can you give me a sense of their regularity?
Pretty constant. I would say that often they are quite far away from where we are, but let's say at least on a daily basis, several times we've heard many loud explosions. Of course, difficult to fully understand exactly what's the cause of them or where they come from.
William Schomburg, thank you very much indeed.